Welcome to the University of Mississippi Medical Center otolaryngology residency program. My name is Cindy, and I'm going to be your guide for a deep dive into resident life. Let's go meet our pediatric ENT team. I'm here with two of the residents on our pediatric ENT rotation, Hudson and Kelsey. So tell me, how does the program split up your rotation schedules throughout the year?
So we're split up into 2-month blocks. Those typical blocks would include the VA, pediatric ENT, head and neck, and then our facial plastics, otology, and laryngology experience are grouped together, as well as our general rhinology and sleep services are grouped together. So it's based off of our attendings.
And what research opportunities do you have?
So that's a great question. So we have 2 months of research built into the 2nd and 4th years of our residency. So that's dedicated time for research, and we really try and protect those residents during that time to give them the best opportunity to accomplish their research.
Kelsey, tell me more about the pediatric ENT rotation.
Yeah, so we have 3 pediatric attendings, Dr. Harbarger, Dr. Karen, and Dr. Reed. We rotate on peds during our 1st, 2nd, 4th, and 5th years. So every year with 3rd, and you do 2 months at a time. This is usually everybody's favorite intern rotation because you get so much operative experience. We're in clinic 1 to 2 days a week, so there's lots of OR time, lots of cases. It's fast paced. You really learn how to run an OR and operate intern year.
Tell me about the typical morning on peds.
Yeah, so I live close, so it's a short commute for me. And UMC provides covered parking for all residents, so that's nice. Probably get here around 6:30, round on any patients that we may have that stayed overnight from the night before, or any consults that came in from the night before, and then go to conference at 7 a.m. On Monday, Wednesday, Friday, or start in the OR at 7 on Tuesdays and Thursdays.
So who's your favorite lecturer at conference?
Dr. Jackson brings donuts.
Yeah, that is.
But Dr. Eba brings homemade bread.
Oh, yeah. So I guess whatever attending brings us the treats.
All right, let's go meet up with a few of our other residents. I'm here today with our head and neck intern, Shelby, to find out more about what it's like to be an intern on head and neck. So tell me, how's intern life on head and neck?
It's been really good. The other residents have made the transition to being an intern really easy and smooth. As an intern, you hold the consult pager, so you see consults during the day. You typically see them with our wonderful PA Tristan or one of the other PAs or MPs who work on our team, which is really nice because they get to bill for the encounter, they get to write the note, and so you get to learn from the experience without kind of all that added stress of having to write the note. It also prepares you for taking call as a PGY too.
So where do you spend most of your time during the day?
Well, I'm in the clinic 1 or 2 days during the week. And if I'm not in clinic and not seeing consults, then I'm usually in the OR, which has been really nice as an intern, being able to spend so much time in the OR.
So Shelby, what's your favorite thing about the lounge?
Well, I like the lounge for multiple reasons. 1, it's in a convenient location. It's right above the emergency room and right next to the ORs, so you don't have to travel very far for anything. 2, there's a consult room attached to the lounge, so if you've ever seen consults, you can take them to the consult room and it's stocked with everything you could possibly need. And lastly, but probably most importantly, it's stocked with snacks. We get a budget for snacks based on the in-service scores, and our program is constantly...
That's the only reason I studied.
Our program is constantly blowing them out of the park, so we have a good snack budget.
So since you moved here from out of state, what's your favorite thing or most surprising thing about Jackson?
I really like that family atmosphere of Jackson. I have a husband and a 2-year-old, and so it's really nice being able to have them here. There's no traffic, which I feel like was big for me, and I feel like most importantly, it's just the other co-residents and attendings are just so welcoming and nice and always there for you, and that's been really great.
All right, let's go meet up with our other interns. I'm here with Trace and Casey, 2 of our interns. So Casey, what made you apply to ENT here at Mississippi?
So what really drew me into this program was that the residents really do feel like a family, and that was important for me coming in and not knowing anyone. Also, all subspecialties are pretty balanced and well represented. So that was important to me to kind of, get all my bases covered and not close anything down.
And how has it been settling into Mississippi, coming from out of state?
It's been good. From the very beginning on match day, people were giving me inputs about where to live. Everywhere's pretty affordable in Jackson with some good neighborhoods that are pretty family oriented. So that was important to me. My co-interns have been great, Shelby and Trace, in terms of being there for me when I'm off service and kind of just filling the gap.
Trace, what off-service rotations do you guys spend time on during your intern year?
Yeah, so we get the opportunity to rotate on oral maxillofacial surgery, trauma surgery, pediatric surgery, the surgical ICU, anesthesia, and emergency medicine.
And what's your favorite thing about living in Jackson?
So I'm a little partial because I'm originally from Jackson, but Jackson is a big city that feels like a small town. You get to know a lot of people and become friends with a lot of people as well. It's got a lot of different things to do, a lot of outdoor activities. We're really close to the Natchez Trace and the reservoir. There's also a lot of great restaurants around, and Jackson's growing steadily. And so it's a really great place to live.
All right, let's go check in with our head and neck team. I'm here with two members of our head and neck team, Hunter and Alberto. So tell me more about the head and neck rotation.
So our head and neck rotation, it's 4 months for the lower levels and 2 months for the upper levels. We have 3 attendants, one of them that does ablative surgery and 2 that do microvascular. Between them, we have a pretty good surgical experience that includes oncologic surgery and endocrine surgery. We get a lot of time where the upper level is just walking through the lower levels through cases. Another good thing is that we don't have a fellow doing microvascular, so the upper level gets to do a lot of microvascular, and in general is a very complete experience for us.
How many flaps do you do in a typical week?
So typically we do 1 to 2 free flaps per week, which means we do have to do flap checks as residents. These are done every 8 hours through 7 days post-operatively. So they're done first thing in the morning and then again on afternoon rounds. And then the overnight on-call resident will come in and perform 1 flap check each night.
Tell me about the typical day on head and neck.
So we all get together here in the lounge to pre-round. We chart check and we get here anytime from 6 to 6:40, 45, depending on how many patients we have in service. After we chart check, we go see each patient and then come back to the lounge. We work on notes until we have to go to the OR. And as soon as we're done with notes, the intern will join us in the OR to get some hand experience as well.
What about time in the clinic?
So on head and neck, we operate 4 days a week and we're in clinic 1 day a week. On Wednesday mornings, we have head and neck new patient clinic, followed by head and neck tumor conference, which is a multidisciplinary meeting with many other physicians for different specialties to talk about our head and neck patients. So it's a great opportunity for residents to make their own treatment plan for all of our head and neck cancer patients.
All right, well, thanks for spending time with me today.
Yeah.
I'm here with Britton and Jamie, 2 of our other residents. So what rotation are you on now?
So right now, my lower level, Jamie and I are on this VA rotation.
The VASPA.
VASPA, as we call it, yeah. So it's a little bit of a lighter rotation compared to some of the other ones, head and neck and some of the other rotations. So you have a little bit more time to, work on any research projects that you have going or stuff like that.
What's your autonomy like here at the VA?
Autonomy, I think, is one of the strengths, I would say, of this rotation. You really get to develop your confidence as a clinician, and at the same time, in the operating room as well, which we are about 4 days a week with some clinic mixed in. And so, and then of course your attendings are always just, a doorway over in the next office if you have any questions.
So tell me about your relationship with your attendings.
The relationship is very easy. I would say all of them are just a text away with anything that you might need. Very friendly.
Yeah, and also very sociable as well. So it's not uncommon for Dr. Stringer to host a resident dinner at his house. Dr. Jackson will frequently have pool parties at her new house, and then of course Dr. Schweinfurth's legendary Super Bowl party, which always get out of hand.
And what do you like to do for fun with your co-residents?
So we get together pretty frequently. I'd say almost always centered around food or drink.
There's a lot of babies and a lot of dogs.
A lot of dogs,
Birthday parties.
Mm-hmm. A lot of real babies and fur babies. Both about the same amount of work, I'd say. So not at all, but.
All right, well, thanks for spending time with me today. I'm here with two of our other residents, Brandon and Alex. So tell me about the rotation you're on now.
Yeah, we're on our service we call GRS. It stands for General, Rhinology, and Sleep. So there's 3 attendings, 1 for each of the acronyms. And I think it's a great service to learn what it would be like to be in private practice and get to have some of those experiences. And it's something we do years 2 through 5, and it's 2 months a year. So you get some good continuity, but you also get to refresh your skills every year. So I think it's a great rotation. We get a lot of good learning from it.
Okay. And what electronic medical record do you use here at UMMC?
Yeah, we use Epic, which is a fantastic medical record and something that we have really worked hard here to utilize a lot of the functions to improve efficiency within the department with notes and templates and such. So I think it's a great thing for us, and we really enjoy it.
Alex, tell us about your call schedule.
Sure. So starting with the intern year, during your 6 months of ENT, you work 2 weekends out of the month in buddy call, so paired with the lower level that's on call. So you get some experience during the day seeing consults. And then years 2 and 3 on lower level call, you take call from home. You take it 1 out of every 6 nights. And then we do power weekends here, so you're on from Friday to Monday. And you cover 1 out of every 6 months, or 6 weekends, I'm sorry. And then we split trauma call here with 2 other services. So 1 out of every 3 weeks we cover trauma. We cover 3 main hospitals: the main university hospital, the women's hospital, and the pediatric hospital. All 3 are on the same campus and connected to each other, so you don't have to drive anywhere when you're on call. The VA hospital, which we also cover, is just across the parking lot from that. Some other things about being on call: you get meal tickets provided to you every time you cover call that can be used in the cafeteria or at the coffee shops around the campus.
Okay. And tell me about the culture here in the department.
Yeah, the culture is great, and it really starts at the top. Dr. Stringer has worked hard these many years to position ourselves well and develop a department that's well respected across the entire institution, and do that in a way that's organizational. It's a great program in that regard, in terms of focusing on the majors and minimizing the minors, and really creating efficiencies for us in our education as residents. So, and then Dr. Jackson, our program director, she is our biggest advocate and fights for us very hard. She always has our back, so we feel safe and supported. And then that kind of just trickles down to the rest of the faculty, who are also very engaged in our education and just making sure that we get a good experience.
Okay. Well, let's go check in with a few of our other residents.
I'm here with 2 of our FPOL residents, Ben and Brian. So tell me more about the FPOL rotation.
So FPOL stands for Facial Plastics, Otology, and Laryngology. We have our facial plastic surgeon, Dr. Jordan. We have our otologist, Dr. Ebide, and we have our laryngologist, Dr. Schweinfurt. We start this rotation as PGY2, and then we do it every year all the way through residency.
What's a typical day like on this rotation?
Yeah, this is a great rotation. Pretty spread out in some good spots. We do all our surgeries pretty much outpatient here at the day surgery center in the hospital. All of them have a clinic day over at our main ENT clinic floor across the street at Lakeland Medical Building. And then Dr. Jordan has a private facial plastics clinic about 10 minutes north on the interstate that we'll spend a day or so out a week. There's also a skin cancer center there where we're doing Mohs surgery. And at the facial plastic spot, we actually get to do resident Botox and filler injections on some patients too.
And what educational opportunities are available to residents here?
So we have our resident conference meetings every Monday, Wednesday, Friday from 7 to 8, where we have lectures from different attendings. We have our research meetings, that kind of stuff. We also have temporal bone lab that we do monthly. We have a new sinus lab that Dr. Stringer just started that we're going to have sinus course every or 4 times a year.
We do microvascular labs, we do cadaver labs, and then we do plating courses for like facial trauma stuff too.
Do you guys get any opportunities to attend national meetings for research?
Yes, our department, one of my favorite things about coming here was that they really encourage you going to at least Academy or COSM every year, and they help you pay for you to get there. Really pay the whole conference. They send the 2s and 4s and the 3s and 5s together, which is cool, so you got a little bigger group, everybody can hang out, and it's a great time. You get to learn all that stuff.
What do you guys like to do for fun on a long weekend?
Man, look, Jackson has way more stuff than I ever thought it would have. You got the reservoir, big kind of outdoor water area, people hanging out at restaurants, fishing, that kind of stuff. We go to plenty of places to eat around here, no shortage of that. And then we all live about 15, 20 minutes from each other, so we make our own fun. We hang out on the weekend during the week too. It's pretty neat.
Thanks for chatting with me.
All right, my name is Jackson Jordan. Hey, Brandon Shepard. We're both fifth-year residents here at UMC, and Cindy asked us to talk a little bit about some of the medical missions that we had gone on. So I'm going to talk about mine first and then let Brandon talk about his. I think it's one of the big selling points of our program that we're given the opportunity to go on mission trips. Not only that they're 100% paid for, and the department will give you at least 1 week to go on the mission trip, and then if the mission trip goes over that week, then you can use vacation time to extend your mission trip. I had the opportunity to go to Migori, Kenya with Kenya Relief last year in November, and it was a head and neck mission trip. Most of the trip was revolved around treating patients with large head and neck masses. Kenya Relief is a nonprofit organization. They actually have a orphanage, school, and a clinic/surgical center. And so we stayed there on the grounds, got to know the kids, got to play with the kids, and kind of see all the good things that Kenya Relief was doing there. But and then during the day, we would go and operate. We did 66 operations, mostly salivary gland tumors, thyroidectomies, with a smattering of other different ENT disorders. And it was really fulfilling to see that we made a big impact both spiritually and physically, because a lot of these people were seen as cursed or as having bad luck because of their large masses. And so this is a trip that we're going to continue to go on every year. Our surgeons, Dr. Jefferson and Dr. Jackson, and most likely Dr. Kane, who just joined us, will continue to do this trip. And so we're really excited about that, and that's something that you could definitely look forward to here at UMC.
Yeah, I'll talk a little bit about the trip that I went on as well. We went to a rural town outside of Tegucigalpa, Honduras. This is a trip that Dr. Reed takes every year, and it's predominantly he's one of our pediatric surgeons, so it's predominantly a pediatric trip where we did 32 cases, the majority of which were adenotonsillectomy, but it's an incredible opportunity to get to just serve other people, and it's something that I hope to do in the future. And it was a great learning experience for how these trips are structured, and the education at these trips goes well beyond the surgical experience. And so I think it's an incredible opportunity that we have, and something that is a great benefit from our program. And I will say that these are a couple of our experiences and things that a few of our attendings do every year. But if you were to come here and find some trip that you were interested in that went elsewhere that was not involving any of our attendings, that's fine, and that's something that they encourage and they want us to be about and to be doing. And I think it just continues to speak to the culture of our program.
Thank you for joining us, and I hope you learn more about our residency program. If you have any further questions, please feel free to contact us. Also, don't forget to check out our website.